Good morning, everyone. My name is Minna Komu, and I work as a OuluHealth Network Director, and it is my pleasure to welcome you all to the very first health talks organized by OuluHealth. OuluHealth is an innovative and a globally recognized health and well-being ecosystem located here up in the north in Oulu. OuluHealth brings together various stakeholders like universities and research institutes, University Hospital, City of Oulu's social and welfare services, local health and life science companies, as well as Business Oulu. The aim is to deliver more advanced, personalized, and connected health services for the benefit of the citizens and creating new innovations and to boost the health tech business. Last but not least, I would like to mention the Oulu Health Labs, an innovation, testing and development environment consisting of 3 different environments, both for companies as well as for healthcare professionals. Oulu Health Labs is welcoming customers from all over Finland as well as all over the globe. We have had several international companies also there testing their services. The furthest guests are from Japan. From our website, www.ouluhealth.fi, you may learn more about the testing and co-creation opportunities. Today, you will first hear about the Digi-HTA by Jari Haverinen, followed then by Terhi Holappa, Usability, who will tell you more about the new standard for health software, especially for the health and wellness apps. I hope that today during this webinar, you will keep your mics off as well as your cameras off. However, please be active and ask your questions. So right after Jari's presentation, you will have your chance to post the questions, or alternatively, you may use the chat box. After Terhi's presentation, then you can ask your questions from Terhi. So we hope this will be an interactive session. So once again, welcome you all. And with these words, I would like to welcome you, Jari, to start your presentation.
Okay, good morning, everyone. My name is Jari Haverinen, and I am a Senior Planning Officer from the Finnish Coordinating Center for Health Technology Assessment. Today I'm going to tell you about the Digi-HTA, which is the new process to perform health technology assessment for the digital healthcare solutions. Okay, first, a few words about health technology assessment, if this term is familiar to all listeners. The health technology assessment is evidence-based evaluation of the properties, effects, and impacts of the health technology. And the keyword here is the evidence-based, so we need the evidence to perform the comprehensive assessments. And the term health technology covers all kinds of treatment methods, such as medicines, medical devices, and so on. And its main purpose is to inform decision makers in order to better support the introduction of new health technologies. And how the HTA is organized in Finland. And first, this is my organization, the Finnish Coordinating Center for Health Technology Assessment, FinCCHTA. This objective of this unit is to coordinate and develop the HTA in Finland, as well as cooperate with the international HTA bodies. And this unit is located at the Oulu University Hospital. And then there are FIMEA, Palko, and Hila. And as you can see that most of the HTA activities are related to medicine in Finland at the moment. If we are talking about HTA for digital healthcare solutions, I can say that this HTA for digital healthcare solutions is increasing trend in the worldwide. There are few good examples like the NHS apps library in the UK. Then there are DiGA directory in Germany, and then there are mHealth repository in Belgium. And for example, in Germany, there are reimbursement process linked to approved apps. But most of these repositories are focused only mobile apps. And there are also standardization activity ongoing for the mobile apps, and Terkko Health will tell you more about this today. And if we are thinking about the field of digital health, the most significant part of the technological solution in digital health field are mobile apps. But however, the mobile app can only be a part of digital health service. There could be a platform which monitor activities of the elderly people. In that case, the mobile app can be used to inform healthcare professionals or relatives about the health status of elderly person. And the mobile app can be a part of rehabilitation robot solutions. And the mobile app can be connected to remote monitoring sensor and so on. And also artificial intelligence solution as well combination of different technologies are increasingly coming on healthcare sector. So why new HTA methods is needed for digital health in Finland? The previous fast HTA methods in Finland did not include essential for digital healthcare technologies, such as data security and protection and usability and accessibility. And to support HTA activities for novel digital technologies all of kind, general purpose HTA method is needed. And the development for the new general purpose HTA method has been started on the EU-funded DigiHealth HUB project. This project is operated under auspice of Center for Health and Technology. And this work commissioned by the Ministry of Social Affairs and Health. And this development has been done in cooperation with the University of Oulu, Faculty of Medicine, and the FinCCHTA. And end of 2019, a new general purpose HTA method called Digi-HTA has been created and published. And Digi-HTA support HTA activities for all kinds of novel digital healthcare technologies, such as mobile apps, AI and robotics, as well as combination of those. And here you can see that what domains are included in Digi-HTA. And as you can see, our aim is to form comprehensive view about the products in the perspective of healthcare. We have the general requirements, and then we have the special requirements for the artificial intelligence and robotics. And in data security and protection, we are using the criteria which were developed in Cyber Health project. These criteria were developed for the procurement phase of digital healthcare services, but in our development work, we realized that this criteria can be used as the assessment phase as well. And what are the typical features of our process? To make comprehensive assessments, detail level information provided by the company about the product is needed. Because if we are relying only public sources, it's very difficult to make assessment at detail level. For example, products data security and protection. The assessment is based mainly on information provided by the company on its own product, but the information is supplemented by literature review and the necessary expert assessment. And our recommendation is public document, but the recommendation does not contain the supplier response material and any company confidential information. Here you can see our process. First of all, I want to mention that our process is confidential. So during the HTA process, the name of the company will not be published. And as mentioned before, we don't publish the supplier response material also. And if you look at the left side, our process starts with the initial meeting with the company. And with this meeting, we agreed the needed information and we agreed the time schedule for the assessment. And we are collecting information from the product with Digi-HTA. With the Digi-HTA, we collect all the information except the data security and protection. And in data security and protection, we are using the documents which we were developed in a cyber health project. And data security and protection need to perform comprehensive assessments for the data security and protection. It needs a very strong expertise. So for that reason, we are using external experts to perform that tasks. And at the moment, we are using the Oulu University Secure Programming Research Group for that task. And when we get the response material from the company, we start our assessment process, which takes about 2 months with the current workload. And during the assessment, we also make the literature review. So we are looking what kind of evidence is available for this product which is under assessment or the products which have the similar operating principles. And when the recommendation is ready, then we delivered it to the company before this feedback meeting. And after feedback meeting, we published the recommendation on FinCCHTA website. And in our assessment, we have 5 key domains, and we are based on those we are scoring the whole product. And those 5 key domains are effectiveness, safety, cost, data security and protection, usability and accessibility. And we have the 3-level scale to perform the assessment for those subdomains. And based on those, we get the final statement for the product. And if all of those are green, then the final statement is that the use of the product is recommended. But if one or more those key domains are yellow, then there are things to consider when using the product. Those yellow lights does not prevent use the product. The aim of those is that our aim is to highlight issues related to these products. Meaning in practice, meaning that there could be minor shortcomings in usability and accessibility. The information about effectiveness is promising, but the information is still scarce, or the cost of the product are high. So the healthcare decision maker should decide those issues such that they are preventing the use of this certain product in their organization. But if any one of those key domains are red, then the final statement is automatically that there are critical things to consider when using the product. In practice, meaning that there could be vulnerabilities in data security, the cost of a product are unreasonably high, and so on. And we have option in our process that if total score is 6 or below, then the company has the opportunity to decide that the Digi-HTA recommendation will not be published. In practice, meaning that more information is needed about effectiveness of the product, data security vulnerabilities will be fixed, or so on. And we can agree the possible re-agreement time, or company may also withdraw completely from the assessment process. And if we are looking in detail level about those 5 key domains. In effectiveness, company provide information what kind of effectiveness can the product offer. And the manufacturer provides evidence about the effectiveness of the product against its benefits and intended purpose. And preferably, the evidence is peer-reviewed studies with a sufficient number of samples. And as mentioned before, the evidence found by literature review in other digital solutions with a similar operating principle will be noted. And we are also interested that does any institution, like another country's HTA agency, recommended the product. And safety, we are interested that does manufacturer identify any risks, possible side effects, or other undesirable effects associated with when using the product. And does the manufacturer have the plan how to reduce those above risks? And does the manufacturer have process to handle error situation? And are there any safety incidents, close call, or adverse events recorded when using the product? And in cost section, we are interested that what are the initial maintenance costs, and does require changes in premises, requirement, information systems, operational processes, or training for personnel cause any additional cost. And we are also evaluating cost versus product's benefits. For example, if the product is expensive, but anyhow can be using the product reduce or even prevent the need for more expensive follow-up care. And in data security, we are interested how GDPR and its requirements have been implemented, and what are the manufacturer's actions to ensure data security and protection. And in addition on manufacturer's responses, data security and protection issues will be addressed through the manufacturer's other material, like the privacy statement. And we are also doing light security testing for the product. And finally, if any vulnerabilities found during our assessment, we reported those immediately to the manufacturers. And in usability, accessibility, because in the healthcare sector, there could be some disabilities. People may have some disabilities to use the digital services due to age or illness. Then we have to interested that have the special user groups been taken into consideration in product design, and has the product been tested in real user groups, and does the company have the feedback channel that allows usability and accessibility issues identified by the user to become the part of product development process, and does the product meet all the requirements set by the act on the provision of the digital services, digipalvelulaki in Finnish. And here you can see that what our actual recommendations looks like. This is our recommendation for the Terkko Health service for the symptom management of cancer patients. And I think that this is a good example service which includes a different kind of approach for in digital health field. Because these systems service includes the mobile app or web-based service for the citizens, and this service includes the web-based service for the healthcare professionals. And this service also have a machine learning based algorithm included. And if you look at the left side, then we have the first of our recommendation. We have the informative part of our recommendation. So we provide the information about product and its intended purpose. So we provide information that is this device a medical device and which classification the device has. And I have to mention that our process is applicable to medical devices and non-medical devices also. And then we have the short summary about our recommendation. And this Terkko Health service get the light green traffic light because there are some issues to consider in the usability and accessibility. And then we have the detail level information about those 5 key areas. And we provide information what are our arguments and what kind of evidence is available for these certain areas. And in this Terkko Health case, their product get the green light for the effectiveness, safety, cost, and data security and protection. And as mentioned before, there are issues in the usability and accessibility. And based on those 5 key areas, we provide the final statement for the product. But we have the section that other things to consider when using the product. Then there we provide information that which kind of platform the product is available, what kind of integration the product has. And in this Terkko Health case, this service utilizes artificial intelligence, machine learning based algorithm. So we are opening the operational logic of this algorithm, and we highlight that special actions needed from the staff to get this algorithm to operate. And this algorithm can be retrained. So we are interested that how the performance is ensured in the retraining, when the system is retrained. And in this case, the company is manually checking the performance of the algorithm. And then we have the information about training and product support. And then we have the information who are already using the product. And then we have the information, are there any other recommendation available for the product? And finally, we have the reference list, which our recommendations are based on. And another example is the Indigo exoskeleton for walk-in rehabilitation. In that case, this product gets the yellow light due that the information about the effectiveness of the product is scarce and there are issues in the data security and protection. So how can the Digi-HTA recommendation be utilized? And if we are thinking about healthcare service providers' perspective, our recommendation can be used as the decision support tool for the procurement, product piloting, or co-creation process, and so on. And health technology companies, this objective assessment allows company to demonstrate the suitability of its product for the healthcare use. And since our recommendation is public document, a company can utilize it, for example, in its marketing. And for example, in Terkko Health case, they released a press release about that this their product and get the Digi-HTA recommendation. And where to find more information and how to contact us. And if you want to find published recommendations and to get more information, you can get the information from this address. And if you want to participate in our assessment process, you can contact directly to me or this FinCCHTA email address. And I want to mention that this is public service, so this assessment process is totally free for the technology companies or healthcare service providers. Okay, thanks. That's all my point of view. Thanks for your attention. Do you have any questions related my topic?
Thank you, Jari. So we have there a few questions already in the chat box, but you may also now just open your mic and ask the questions. We can go first through the ones that are in the chat while we are waiting the live questions. Danny asked that with regard to the cost, reasonable, high, unreasonable, is it considered from the health system perspective or the patient's perspective?
But I think the payer's perspective, if they are, it is I don't understand totally what mean the healthcare perspective meaning, because I think that if we are talking about typically the public healthcare service providers, I think they are both the same. Or is this meaning that if we are providing some app for the citizens, but we are comparing the cost. What are the typical treatment methods, the comparable treatment methods? I think that this is a baseline that which we are starting to evaluate the cost. But do I answer questions? Do I understand right?
I think you covered that one. Then we have one from Erno. Hi, is the HTA assessment suitable only for CE market devices and apps, or also medicines with MAs?
Yes, as mentioned before, our process is applicable to non-medical devices also. So that the product can be the medical devices or non-medical devices.
Next question from Fred. Isn't accessibility of public services such as digital health solutions demanded by law, so that they have to have designed it accessible?
Yeah, they have to be designed accessible, because I think that we have this coming law, the digipalvelulaki, which requires public service providers that certain requirements has to be fulfilled, and also that the people may have some disabilities to use digital healthcare services due to age or illness. So for that reason, those digital products in the healthcare sector should be accessible.
The next question is from Katja. A Digi-HTA assessment is a great tool to ensure effectiveness and value. Which Finnish hospitals require Digi-HTA assessments?
At the moment, we are. I have to say that we are setting up this process, and at the moment there are no official requirements in the hospitals. But I think that in CATIC program, Ministry of Social Affairs Health CATIC program, there are more requirements coming for the products that they should have performed the Digi-HTA. And I think that in some areas in this CATIC program already require at some level the Digi-HTA recommendations.
The next one is from Patrick. What are the requirements on the data the company must provide for the HTA? For example, the size of a patient cohort to test effectiveness, and how long does the preparation normally take?
Yeah, company provides the 3 documents for us. So we have the Digi-HTA and documents for the data security and protection. So the company fulfills those 3 documents and delivers the information for us. And also they include all kind of evidence, research studies, reports, and so on, which is valuable for their product. And experience so far shows that it takes about 1 or 2 work days from the companies to fulfill to our questionnaires.
The next one is from Camilla. So did I get it correct? Can the softwares also be assessed? And if assessed, will it be certified if it passes the assessment? And what value does the assessment have?
Yes, we can. Yes, we can assess the software, but the company, its company responds to get the CE mark or MDA approval. So company defines the intended purpose, and company it is our company's task to get the CE mark or MDA approval. And we have some overlapping issues in our process and in for example in the MDR process. And so I think that if product is already CE mark MDR approved, I think that they are easy to answer to our questionnaires in some part of our questionnaires.
The next one is from Pirjo. Are all the assessment results public, also those that didn't pass?
No, those products which score is below is 6 or below, and if company decide that they are not, they don't want to that the recommendation is published at this stage. So this is not public information. We have few cases that the company has some big shortcomings in their product, and the company decided to redesign their product, and hopefully they come to our process later on.
A question from Neil. How are the thresholds for the reasonable cost, for high cost, and for unreasonable cost defined?
Yeah, it's not easy to define because there are, the solutions are very different in digital healthcare sector. So we have to evaluate those case by case. So if we are talking about mobile apps, or if we are talking about rehabilitation robots, they are totally different kind of products. So we have to evaluate case by case those costs.
Then Camilla asked further, so if we have a CE mark, why is a Digi-HTA needed?
Yeah, yes. If you have CE mark, then you have to then you can sell your devices or software in the EU region. I think it is the license to sell, but we are looking a little bit wider perspective, because in the MDR there are no cost evaluated, And I think that we are going to deeper into data security and protection, and we are looking to effectiveness in wider spectrum also. And if we are also, and maybe if the product is already in use, then there could be some adverse events recorded and so on.
So thank you. Oh, then there is one more from Vilma. Has the classification of the medical device had any effect on the outcome of the Digi-HTA?
Yes, I think that's the more, if the classification is higher, then the more evidence is needed for about the effectiveness of the product.